Welcome back from the break. I hope that you moved away from your screen and that you've come back to join us again. In this next session, I'm speaking to Sandra and Jan Albers, a couple heading towards 25 years of marriage next year, which is congratulations.
Thank you.
Both with highly successful executive careers. They've lived internationally in the UK and Germany. And in the last few years, they have become experts or much more experienced in the topic of depression since Sandra's diagnosis. Welcome, Sandra and Jan. It's great to have you both with us today.
Thanks for having us.
Thanks
Very
for having
welcome.
us.
So, Sandra, I thought it would be really good to start if you could share with us a little bit about your journey with depression and how this has impacted your life, just so people can get a feel for who you are. And yeah,
Sure. So we need to probably rewind about 30 years, go back to the 90s, different times, different country. And I fell into what I described at the time as a living nightmare. But the living nightmare had no name. It had no diagnosis. And because it had no name and no diagnosis, it also had no treatment.
right.
So I know now, and I'll tell you why I know this in a minute. I know now that it was my first episode of major depression, but I didn't know it at the time. And because it was completely untreated, aside from seeing a therapist every so often, it actually took almost 2.5 years at the time. And it was a very, very tough time on me and on us, and not knowing what was actually going on. So fast forward almost to the here and now. We're now in 2020, difficult year, as I'm sure we'll all remember, because of COVID. And I was diagnosed with breast cancer in June. And so that was very unlucky. But what was very lucky was that it was caught early. It was treated, surgery, all the rest of it. And I remember that the day I left hospital, Jan and I went to see the head surgeon, and he talked me through the anti-hormone treatment that I was going to be put on. And he said, one of the major side effects, if you should be so unlucky as to get it, would be depression. And I laughed in his face. And I said, there is absolutely no way I could ever have depression. I'm such a jolly person. I'm very outgoing. I love my life. And of course, this is exactly what happened. He was right. About 3 months into the treatment, it triggered another bout of severe depression. And this time round, I was extremely lucky because I was already seeing a therapist who had been a doctor in a psychosomatic hospital. So it took her all of 5 minutes to recognize what was going on. She then referred me to a psychiatrist very fast, which is not a given, at least not in Germany. We know about the long waiting lists, who, again, confirmed the diagnosis, put me on antidepressants very fast. Although I have to be honest, it took us about 10 months for them to truly work, because we had to up the dose quite a lot.
Right.
So it was a very, very tough 10 months. And I can talk later more about the symptoms. But that is kind of my story to date. And the only thing I would say is going from a point where on the lowest day of all of them, Jan and I had to come to an agreement that he was going to take all my medication off me, because we didn't feel confident that they were safe with me on that day. I'm sitting here now. I can talk to you both. I am feeling healthy. I'm feeling happy. And that, that should be that. I want this to be my closing sentence to your first question, to say, you can get from hell to healthy.
Thank you for sharing that with us. I really appreciate that. What has it meant for you, Jan, Sandra, having this diagnosis of depression?
Yeah, I think the first thing was, okay, things will change. And Sandra already pointed out, I mean, we went through her cancer treatment very successfully, but maybe we were not in this sort of happy-go-lucky mode anyway. So I think sort of recognizing the seriousness was easy. Yeah, switching back into this, okay, this is serious, something will change. I think then it was recognizing the illness And I think this was mentioned before by Tiago and by Professor Hegel, of course. Yeah, I mean, this learning curve, this is an illness. I had an extremely steep learning curve. Yeah, I learned that this is a long-term illness. Yeah, that there are recurring patterns to it. I learned that this is a physical illness of the brain, yeah, which is associated with behavioral change. And so, I mean, just recognizing this, and then as a partner, I mean, if your partner is ill, yeah, you of course want to support your partner. I mean, that's, I would say, very natural. That's what you want to do. We had the story about the mother. Yeah, so I think that is what you want to do. And but then also seeing, okay, I want to support my partner, but I don't want to take over.
Right.
Recognizing, and that is sort of also a matter of being respectful to the individual, to the person. And then there's an element of then sort of how you support it, and I think we get to that. Yeah, but I think that supporting a depression or a depressed partner, yeah, is very broad. Yeah, so I think there's what the ask, yeah, for you as a partner. I think you have to be quite patient. Yeah, you have to be a good listener. I think we get to that. You have to be able to adapt and be flexible.
Right.
Because if I've learned one thing, is that yes, you go through these cycles and patterns, and as a partner, you're recognizing that very, very clearly, I would say. But it's also, I mean, I cannot tell you, I mean, it's like the weather. I cannot tell you today, yeah, whether the sun will shine in a week's time.
Yeah.
And I think that is this kind of what I sense is this adaptability, which is a big ask.
Okay. Interesting. So learning and really understanding, watching, and really having clarity in terms of your role, you know, and Sandra as a person.
Yeah, and I think also being very clear, saying, okay, this is my partner's illness. I will support this, but it's not mine. And I think that's also very important also, yeah, to keep yourself healthy so that you can actually support somebody.
Yeah, absolutely. You mentioned, Sandra, that in managing your depression, you know, you have a bag of tools and routines. Could you tell people a little bit about what that means? First, I think in a healthier phase, but also then perhaps afterwards in a more acute phase. You know, what's the sort of difference in how you manage that?
I'll actually start the other way around, if I may.
Certainly.
So when I was acutely extremely sick, initially I started with tick boxes, and there were only 3 tick boxes to start. It's all I could manage. It was to get out of bed by 8 o'clock in the morning, to try and eat 3 meals a day. And I say to try deliberately because so I'm now back at my normal weight, and I lost 10 kilos during that phase of acute illness because I just could not eat, found it very hard. And also to shower and wash my hair every day. It sounds like a given, but when you're at that point, it's actually not. As I got better, that checklist increased. So I would add a category friends and family. I would make myself call or WhatsApp or email somebody that I loved once a day. I added exercise. I normally exercise 5 times a week, but sometimes when you can't even get out of bed, that's really hard. But very, very soon I made myself. I also started recording almost like a podcast for some of my loved ones, which is great for me because I found I need to talk even more about how horrendous this is. And then and this is now going into the here and now, I started writing a diary every day, which I still do. I also, at the time, I had a jar of joy, which I made myself fill with 1 piece of paper every night.
Right.
And even if I thought the day had been absolutely awful, I always found something, whether it was Jan smiled at me and I could feel it, whether it was I saw a flower in the forest and I liked it. So it was those sorts of things.
Yeah.
And now that I am, in terms of the medication, thankfully I'm where I should be. I've got a really good buffer. I do have dips, so I'm not completely stable all the time, but the dips aren't that low anymore. And I try and see them coming. So the routine that I established initially, I keep that going. So I get up early enough every day. I have breakfast with Jan. I then do a French lesson online every day. So that's kind of my routine. I exercise almost every day. But I also listen to the warning signs, you know, and I can generally feel when I start, my heart starts racing, but at the same time, I'm beginning to feel exhausted. That to me is always a warning sign, and also a pervading sense of dread. That's one of the warning signs for me, and that means I need to slow down.
Right, right. And how do you, Jan, you know, particularly when there's an acute stage of depression, you know, what is your role in supporting Sandra there? But also, as you said before, it's Sandra has the disease, you don't have the disease. So how do you keep yourself healthy, you know, within those periods of time?
Yeah, maybe let's go back to the support bit. Yeah, and I mean, what I mentioned earlier, I think sort of support can be all manner of things. Yeah, so I mean, and every patient is different. I recognize that. Yeah, so I mean, I can only speak for my experience. I mean, Sandra, I mean, if the worst stage is pure panic. Yeah, and if you find somebody in pure panic, yeah, you try to break the pattern in the mind. Yeah, so one of the things which I've learned, and I don't remember where I picked it up. Yeah, it was sort of that you fire questions at the person saying, okay, give me 5 things you feel now, 5 things you see now, 5 things you hear now, and this is just so, okay. Complete distraction, panic subsides. So that worked. Yeah. Sandra mentioned the weight loss. Yeah. I mean, I think then it becomes a bit more practical, saying, okay, she needs to eat. For some reason, I don't remember why. Again, yeah, we figured out if she's walking, yeah, then the food gets in and it stays down, right? And so what do? I mean, you cut up bite-sized pieces and saying, okay, here's your plate, finish it up, yeah. And practical things. For example, I mean, one of the worst nightmares for me as a partner is this question: did I take my medicine? And I mean, you're rolling your eyes and saying, okay. I mean, and then I basically said, look, Sandra, it's not sexy, but there are these pill boxes, yeah, 7 days a week, Monday lunchtime, evening, get one. Took me a while to convince her, yeah. But she ultimately got one, and I think that just ticked that box, yeah. Box is empty, fine, yeah. And the sort of, I think, as a partner, you're and supporting your partner, it's sort of very much about understanding the necessary disciplines and supporting those. And I think that's sort of what we try to do every day. And then also, I mean, you mentioned, I mean, I try to sort of, and I can only encourage partners to do so, don't make it your illness for various reasons. I mean, I think probably the most important thing, especially in a partnership, is to sort of recognize that there are behavioral patterns. And if behavior towards you changes, yeah, the natural reaction is it me? But it isn't. It's the illness speaking. Yeah. And I think sort of keeping this distance is very helpful. Practically, it's also, you're a much better observer of these patterns. I mean, in sort of normal mode, not panic mode, normal mode, one of the key things I need to do is assure Sandra to saying, look, this is a pattern, it'll pass. Yeah, because if Sandra is in a hole with depression, yeah, I mean, the last thing her brain will tell her, it will pass. Her brain will tell her, this will be forever and I'm miserable. Yeah. But I have obviously seen this going up and down so many times. Yeah. And I think just assuring her this will work.
Yeah.
And then for me, I mean, just to stay healthy, apart from sort of keeping the distance, yeah, not making it my illness, yeah, I'm trying to have my own routines, yeah. So I mean, we have a bit of a different sleeping pattern, yeah. Sandra's a night owl, or I'm an early riser, yeah, so that in the morning gives me an hour to myself, which you need, yeah, where I can just do the stuff I want to do my sports, do something practical, read something, whatever, yeah. I think that's very healthy.
Okay. Thank you. So routine.
It is a lot about
routines.
routines.
The flow.
Yeah.
Sandra, you've said that you wish people understood depression as an illness and what it feels like. Could you have a go at explaining, you know, what it feels like for you?
Yeah, exactly. So I'd say first of all, depression is often called the condition of 1,000 faces. But as far as I'm concerned, imagine you are sitting in a glass cage. And you've been in that glass cage since about 4 or 5 o'clock in the morning when you woke up with your heart racing and a feeling of impending doom and dread all over your rib cage, your sort of up here and your rib cage. You're then sitting in that glass cage. You can see people around you, but no matter how desperately you try to reach out to them, you cannot reach them. And you're getting more and more desperate. On a better day, you don't feel anything. But on a bad day, you're feeling a sense of dread, even towards your nearest and dearest. And on top of that, you are quite weak because you've lost all this weight, because you cannot eat. And what your brain is telling you is this will never change. And you've educated yourself so much, you've almost got a PhD in psychology by that point. But all your brain's telling you is, well, you now know how it works for other people, but for you, you're always going to stay sick.
Yeah. Okay. I'm conscious of the time and there's questions coming, but there is one question I wanted to ask you both first, which was, you know, when families and friends in all aspects of our life, people like to give helpful advice, and sometimes it's helpful and sometimes not quite on the mark. How have you managed that as a couple in terms of your depression, Sandra? And, you know, how do you manage those moments?
So on that note, I'm going to hold up these two books. So that is just an example of what we've done. So we've both talked about learning and educating yourself about the illness. And the same goes for friends and family. And one of the things we've done is we've actually given these little books. They're by somebody by the name of Matthew Johnston. They're called, they're the Black Dog books. And he suffers from depression himself, and he has made these, I'm just going to open up a random page. He's made these amazing cartoon books where he describes, so one book is actually aimed at patients, one at relatives, what depression is and what it isn't. And the one thing that becomes very clear from these books is depression is a serious illness. And one of the things sometimes when I've had to be very blunt with people, I've said, you've just told me I should take a walk in the sunshine. If I had a multiple fractured leg, would you also say to me, I need to take a walk in the sunshine and then the leg will mend by itself as if by magic? And the answer is, of course not. So sometimes I use those analogies, or I say, if I had diabetes, you wouldn't say, stop taking your medication and go for a walk instead.
Excellent. Thank you.
I would just to add to this, I think there's also an element to be transparent about it and be open about it. I mean, Tiago mentioned that in his speech and with his No Shame initiative to just tell people about it. And yes, you will get the odd not so good advice, but I would say in our experience, more often than not, much more often than not, I think people will actually want to understand more. And I think then we have now become small experts in this, and I think then you can just sort of pass on this knowledge, and that helps everybody.
And people will come through for you. They will.
Excellent.